blood. You know it used to be mad love. So take a look what you've done. Cause baby now we got bad blood.
Hey there, these are my puppies and no, I'm not home right now. I'm at the Symbiosis Girls Hostel in Vimannagar, Pune. And these little guys are Euro and Yen. And they have been given to the girls by Miss Vijay Yerwadekar, the Vice Chancellor of Symbiosis University. Let's find out why.
The puppies have been brought into the hostel mainly because there is something like a pet therapy which has been put into what you call practice in I think many countries perhaps. The students presently are having a lot of emotional problems and psychological problems and many problems because of the work pressures are so much that the demand is so much and they don't have that kind of time perhaps. So they want to excel, the competition is too much. Therefore, the peer pressure, all these things will be there. So they want to rather do very well, but sometimes they get frustrated and they may do what you call dejected or something. They may feel dejected. That's the reason they want to introduce this kind of pet therapy, where if you are diverting the attention of the stressed out people towards something which is a pleasant kind of experience, then it may act on the what you call the students in such a fashion that will completely soothe their nerves and all that, and it will be having a positive impact on their well-being. Quite a few girls are suffering from PCOD, that is the Polycystic Ovarian Disorder or some syndrome. This causes a lot of problems for them emotionally also and health-wise also. They become what you call slightly bulkier, and they have warts or pimples and all that, and weight gain, and kind of stress and emotional kind of upheavals and all that. And this is not good for what you call their studies or for their health as such. And I'm very sure that these pets and all that will definitely have a positive influence on the minds of the girls who are suffering from this kind of disorder.
What really are polycystic ovaries? First, we need to understand what happens in your ovaries during a regular period. This is the female reproductive system. Here is the uterus, these are the ovaries, and these are the fallopian tubes. During a regular cycle, 100 or so eggs begin developing inside the ovaries in liquid-filled sacs called follicles. The pituitary glands located at the base of your brain sends hormones to the ovaries, causing the follicles to develop further, which then release estrogen. After which, the pituitary sends another round of hormones to the follicles, causing the most matured one to burst open. This is called ovulation. The other partially developed follicles then dissolve within the ovary. In the case of polycystic ovaries, the pituitary sends excess amount of hormones, causing the immature follicles to remain where they are, forming cysts in the ovary. In some bodies, where insulin is present in high amounts due to unhealthy eating and drinking habits or no exercise, the hormones secreted by the pituitary mix with the insulin causes excess testosterone release in the ovaries. This stops ovulation from taking place and causes symptoms such as acne, excessive hair growth, or irregular periods. This is PCOS. So, what finally is the difference between PCO and PCOS? PCO is very common and is a variant of regular ovaries in which cysts are formed but no symptoms are detected. 40% of the women have PCO and may never know unless they conduct an ultrasound. PCOS is a metabolic disorder related to heavily unbalanced hormone levels released by a patient's ovaries, causing symptoms like acne, irregular periods, or excessive hair growth. It affects around 20% of women. Patients with PCO do not have any issue conceiving, while patients with PCOS tend to suffer from infertility. 1 in every 5 women have PCOS, and you may never even know. We spoke to a few of them who were ready to share their stories with us.
So this was like about a year back when I didn't have my periods for 3 months. And so I told my mom, it had been happening like a lot of times. I didn't have them for 2 months. It was like a regular thing. I thought probably, whatever. So after 3 months, then my mom got worried. So she spoke to one of her cousins who's a gynecologist. And so she then told my mom that she might have PCOS. And so she listed a number of tests that she said get this done and confirm if it's that or not. So here in Pune at the AFMC, my dad's in the army, so we went to the AFMC, met with the gynecologist, got the test done, and so after the reports came, so the gynecologist said I have PCOS.
So last year in fact, I started getting irregular periods, and I didn't think it was a big deal because it's supposed to be really common, at least in my friend circle. A lot of other people do get irregular periods, and even my mother said it happens once in a while, so I didn't pay much heed to it. But then I started gaining a lot of weight, and then I started wondering, that there must be some reason behind this. So I went to the doctor, and the doctor told me to go get a sonography done because until then he wouldn't know what's wrong. So I went to get my sonography done, and I heard the doctor in passing say I have PCOD. And at that moment, I didn't know what exactly PCOD was. So basically, since I didn't know what it was, I obviously went on Google and typed it out and tried to search it online and what PCOD means. And I got some horrific and very scary results. Don't ever go and Google whatever you think you have until you've gone and consulted a doctor. The first thing I saw was leads to cancer, which scared the hell out of me. Then I saw excessive gain weight. Then I saw excessive hair growth.
When I was 12, I got my period, and for 2 years the doctor said that it's fine, like if it's irregular. I used to get it once in 2-3 months, and it would go on for 20 days. So it was always bad, but I thought that we'll wait for like 2 years till it regularizes. Then I went to a gynac, and they did a lot of tests. Like they did the usual sonography, they checked if it was thyroid, they checked my hormone levels, and then they were like, you have PCOD because we can see the cysts. And like I've had to take a sonography ever since, every year. And so then I've been on treatment since then. It's about 6 to 7 years now, but it's still not regular at all.
I found out in the 10th grade, 9th or 10th grade, and I put on a lot of weight suddenly. I was a very athletic child, and all of a sudden I put on a lot of weight, and I always had an acne problem, which was really bad, and it just wouldn't go no matter what I applied. So I went to the gynec, and she had some tests, and that's when she found out that, she told me that I have polycystic ovaries, and
I found out very recently, in fact, because I'd always suffered from irregular periods, but my mom always tried to tell me that it was because either I was shifting terrains because my dad is in the Air Force and we were moving constantly, so either it was that, or probably she said that because I started playing water polo eventually, so she thinks it's probably because you're a sports person. So for the longest time, no one took it seriously that I didn't have regular periods. And then recently about 4-5 months ago, I went and I got it checked because I heard from a lot of girls that they had PCOD. A lot of girls around me had PCOD, and kind of started to scare me that because I had similar symptoms and all of them, and I didn't want to be a part of this disease. So then I got it checked, and in fact the first time I went and I got it checked, my doctor saw it. She said you're okay, and she gave me some random tablets, like those Himalaya tablets that are actually homeopathy and that serve no purpose. She gave me those. So then after that, again I missed my period for 2 months, and that's when I got it checked again, and then I found out that I actually had PCOD. So I've been on the medication for the last 1 month, and it's terrible.
PCOD is basically lifestyle disorder. You have hereditary traits also in that. When you have a heredity and you have a bad lifestyle, as in your routine is not regular, then it is precipitated earlier. That is why it is seen in younger women nowadays, because they live a city lifestyle. The routine of the girls has changed, They are studying, they are under stress, they have junk food outside, especially the hostelites, and that is why you are having, you are seeing PCOD more commonly everywhere.
It starts with the irregular periods, and it can range from anything like having it for one day and then not having it for 2-3 months, to having really heavy bleeding for 10-15 days. So, and then there's a lot of acne, there's a lot like your hair becomes really thick, facial hair, and things like that. So, and you put on a lot of weight. That's always bad.
So they gave us birth control pills, and I was doing that for 6 years, and while I was on the birth control pills, I would get my period. As soon as it stopped, nothing at all, ever. So for me, there are two kinds of PCOD. One is lean and one is obese. So the obese kind, you put on crazy amount of weight. So I didn't have that. So thankfully, like it didn't affect my metabolism or my weight. But there was, I think I had an acne spurt, like maybe a little excessive hair, but not that much. It wasn't that severe. But my main thing was my periods, and it was really uncomfortable because it would go on for 20 to 30 days. By the end of it, I couldn't like stand. Like I used to be exhausted. I used to get mood swings. Like people, like I would scream at anything and everyone around me. And it was bad. It still is. It's not regular at all. So then I switched to homeopathy, and I'm still seeing if that will help.
So, apart from the gynecologist, I also went to an endocrinologist. So they took a couple of other hormonal tests to see. So what he told me, the endocrinologist said that I have like the level of testosterone, which usually girls do have, is a little higher, and that's what's causing the excessive hair growth. And also he said that the periods are irregular is because the ovulation is not happening on time.
Yeah, that's kind of how even I noticed that I wasn't getting my periods, and even like you know how they say that during your adolescence is when you hit puberty is when you get the worst acne. I never had that. I got my first acne outbreak after I turned 20, and I was just like, what is this? Like it was ugly. It is ugly as hell, and I couldn't do anything about it. Like it's not going, and mama ne bola haldi lagao, ye lagao, wo lagao, sab kuch muh pe laga. It's just not going. And then randomly I had a few, like I had three, four stray strands of hair growing on my stomach that were really thick, like male hair. And it was just really weird because I've never even had hair growth like on my body, so I don't have to get waxed that often. But it's just awkward to have. Like it's just really awkward. I didn't know what to do.
I'm crying all the time. Like I'll watch a movie and I'm just weeping, and I can't control it, and then I get fits of anger, and then it's really scary because even my family, they sometimes they just don't know how to like handle me. So they'll just be like, okay, she's on her period, just let her be. But it's sad. I hate being that person, and it's not like I can control. It's not like, okay, 3 days before my period and 3 days after, like the normal people. It's just when I was on those pills, it was like permanent for me. Mood swings were like permanent, and I couldn't control it. And I didn't know when I would just suddenly start crying. And that's not someone you want to be. Like you don't want people to think of you as the sensitive one or whatever. That's not that's not who I am. I like being normal and loud and everything. I don't like crying.
Now you tell me, when person is going through hormonal imbalance, you are not in a synchronicity with your moods, right? So sometimes you get into depression, sometimes you into a neurotic mood, sometimes you're in a violent mood, sometimes you feel that I am nothing. It's like suddenly that emptiness feeling, emptiness syndrome. So because of that you get low self-esteem. Because of that, you cannot function, you cannot perform, you can't even do your studies well, you cannot even get into a career well, you can't even get into your relationship also.
Stress anxiety is also related to PCOD and hormonal problems. Anxiety disorders are related to obesity. Depression disorders are related to ovaries, PCOD. Obese people also suffer more through depression, anxiety disorders, bipolar disorders.
Here also you get side effects. Excessive weight gain. You put on weight. They become fat. Again, there is a drawback in women. Again, the girls feel that I'm putting on weight. And nowadays this PCOD is so common. It's like it's happening 1 in 5. Earlier time it wasn't like that, but now the lifestyle, the generation is changing. This is what is happening.
So sometimes, so when like the growth starts coming back after I've gotten it removed, I start getting conscious, so I'll probably like leave my hair open like I'm doing right now, so it's not visible. Or I'm very conscious when I go out then, so I quickly look for it. Okay, go to the parlor, get it removed again. So I know it's kind of embarrassing, I feel.
So emotionally, it did affect me a little, in the sense that I gained 2 kgs and that really affected me. Like before that, I never thought about my weight or the kilos I put on or anything. I never exercised, I never gave that much a thought. But once I gained that weight and I got to know that it would lead to many other things, like me gaining more weight. That when you're told you have a disease, because PCOD is Polycystic Ovarian Disorder and it's a disease, it scares you a bit, because you don't, like, it's, after all, however minor it is, it's still a problem in you. So it did affect me in that sense, but I did take care of it and consciously took care of it because I was scared.
Being the only one who doesn't have something regular, like you don't know when it's going to come, it's awkward because you can't predict when your period is going to be. You don't have any kind of control over it. Sometimes you just don't have control over your moods.
It's like you are walking on the road, okay? And the one client of mine, she just told me, ma'am, what happens to me when I'm walking on the road and I feel that everybody's looking at me because of my excessive hair. Though very well I know that it's not showing anywhere on top. It's not showing anywhere. But I feel that because of my excessive hair, people are feeling that I'm becoming like a man. So that psychological impact they get. And no one can see. I mean, you can't see. You can only see your face. But because they are thinking so much on this, so that plays on your mind. And everywhere where you go, even your thought process is very different. Even your sensitivity towards things are very different. Even your emotions are also very different. It's like kind of a little ruthless sort of a thing. So it affects your relationship, it affects your relationship with your children also. But if you go through a proper counseling, proper kind of a psychological therapy, you become fine with it.
So I was very insecure about how I looked. So I never felt that I was beautiful or that I was pretty or anything. So it affected my self-confidence a lot. Like I still have a little bit of anxiety when I go and speak to people and things like that. So, I always feel like people are staring at me for the wrong reasons, because I don't fit into the beauty standards. And I always feel like, I wish I had, a smooth skin, and which I don't have. I know it's very first world problems, but there's also the there's also the pain of the periods. So there's, on one hand, you're happy that your periods have arrived because they finally arrived, and on the other hand it's so painful and you don't know how many days you're going to stay for, and the mood swings are crippling, really crippling mood swings. If you're insecure and you have mood swings, it just heightens everything, and it's really bad.
Because of this PCOD, your fertility rate is again reducing. You cannot conceive at all.
You have cysts in your ovary, multiple cysts. Those cysts are due to the immature eggs that you have in your ovary. So these immature eggs remain in the ovary and then they cause cysts. The natural process is when the egg matures in an ovary, every month one egg matures and then it comes out of the ovary and then you have your menses. But when you don't have your menses, that is due to immature eggs. So they remain in the ovary and cause cysts. Then you suffer through infertility.
In our culture, the primary role of the woman is to first of all be the provider, to be the nurturer. So their aim is to give birth, if you look at it. Okay. Now if we can't even do that, then how are we women? I mean, it's not a question that I'm asking, it's a question that society asks, and you feel like you're almost redundant.
It's not like I'm worried about the future, but people will tell me stuff like, are you worried you can't have a baby? Are you worried about these things? And sometimes, those thoughts do come, and I don't want, it's not like I want babies or I don't want babies, I just want to have the choice.
You said your ovaries are not, producing the eggs on time, and that's why you're not having. He said this And like this part kind of freaked me out. He said that this problem usually continues on, like it'll continue on ahead. So like he said, right now I'm on medication to induce the menstrual cycle. He said a lot of people have problems later in life if like you get married, if you want to have kids, so in conceiving, because ovulation is not happening. So he was saying if you go ahead and plan to have kids, then you'll have to go on a separate set of medication.
Like it's just a choice that you want to have with yourself, like whether I want to have kids or not. It's just a choice that I want to have. I don't want to hear. The first time that I went to my doctor, he said that बेटा कोई बात नहीं, तुम चिंता मत करो, बच्चे हो जाएंगे, तुमको इतना सीरियस केस नहीं आना। बात यहाँ तक कैसे पहुँच गई, इतनी ऊपर तक कैसे पहुँच गई बात में, बच्चे को 20 साल क्यों यार? What are you saying?
I just feel like it's my choice. I've never been so pressurized by society. Maybe that's the way I've been brought up. But yeah, I've loved kids because that's who I am, and I feel like I would love to have the choice. It's not, I don't think society, but maybe in other cases, in people like maybe not our income level, but people a little lower who have arranged marriages or whatever. Yeah, I'm sure their lives must be really hell because of this. It's not nice to be the one who can't have a child. It's not nice to be the person at fault.
A lot of time what happens if they get into arranged marriage, then a lot of girls don't tell their husband that this is what I'm going through. When they get married, even their sexual intimacy is also affected. They don't feel like going through this because of the depression, because of the mood swings.
So prevention is by lifestyle modification, basically, by not allowing excess weight gain. Fast food habits have to be omitted, no addictions, daily exercise, adequate sleep. So all these are the factors which will keep our hormonal milieu or hormonal balance perfect, and if hormonal milieu is normal, then it won't lead to polycystic ovaries or Pcos.
Get into a physical exercise, a lot of physical exercise, so that also hormonal balance,
Oh God, not very often. Why would you ask a college student that?
Yeah. And I don't exercise at all.
Don't exercise at all.
Thrice a week.
Once and 2 months. Never. That is natural.
2 times a week.
I don't.
Yeah.
No.
Once in a week.
Once a month max.
Yeah. Once a month. Once or twice.
Yeah, thrice a week.
Not every day.
Yeah, not really often.
Like off late, no, not at all.
I exercised once
Walking a lot.
2 weeks ago, but then I stopped because it was too early.
We actually done.
I used to gym before I came here, but
Never.
Because I'm very lazy. Like I sit at home the whole day. I don't go out and exercise, and this is both the gynecologist and the endocrinologist. Both of them said that you have to start exercising. They said that what they told me is it's basically a lifestyle disease because we have this sedentary lifestyle. We don't go out. We just sit at home. So both of them said you have to start exercising, which I haven't exactly been following.
I did lead a very unhealthy lifestyle in the fact that I would eat whatever I liked. I wouldn't have a control on what I was eating. I didn't exercise. I had no form of exercise. I would go to college every day. I would come back home, sit in front of the TV, do my normal thing, but I didn't have any form of exercise. I wouldn't go play a sport or anything like that.
So yeah, I try very hard, but with college and everything, there's so much to do. I reach home late sometimes. There's class till 6, or there's some assignment or the other. So my mom keeps telling me if you can't go in the evening, wake up early in the morning, go for a walk or go for a run. But then I'm just too lazy to wake up in the morning. So I know I should do it because it is for my health, and I try my best to find time in the day. So I'm going to start working a bit.
It made me more cautious, so I decided to take a conscious effort and actually start exercising and eating right, which I did eventually start doing. And luckily and fortunately for me, because I did that, I gave up on junk for 3 months. I took the pills regularly. I started exercising. I started doing kickboxing, which was great. And I get my periods now, maybe a few days late, but they are regular. I get them every month. And also my lifestyle has become much more healthier.
I'm not the healthiest child. I don't eat the best food, or I don't exercise. And even though I know that I should be exercising to help this out, it's really tough for me because I don't like it.
I didn't even know it was related to a lifestyle. I always thought it was hereditary. So I was like, oh, it's inevitable. But now that I know that it's a lifestyle thing, I feel much more.
So it's like I have to go out of my way to do something when otherwise my body doesn't demand it. It's not like I'm overweight or any of those things. So otherwise, except for this, my body doesn't demand all these things, but I'm forced to doing it to help something that I can't even see. No one can see that this is happening to me. I just feel it.
You know, like it really makes me think, how are we going to be independent, like, you know, independent, strong women if we can't even take care of our health the minute we step out of our homes?
Exactly.
The people, sometimes they go through medication, sometimes even because of those allopathy medication, they are not able to handle that also. So what they do, they don't take it. So what I suggest them every time to go for Ayurvedic medication or a naturopathy. So at least you normally get into a physical exercise, a lot of physical exercise, so that also hormonal balance, you know. And what happens here, the major issues that serotonin hormones, which call happy hormones, are not releasing the way it should. They have a lot of negative hormones. It's the opposite of this positive, negative hormones. So what do you feel all the time is that, you know. So that's basically, it's not a very good disorder. I say if someone has gone through a heart issue, it's better to tackle that rather than this.